I'm entering the room, performing hand hygiene. First, introducing myself to the patient. Hello, my name is John. I'm going to be your student nurse today, and I'm going to be performing a head-to-toe assessment on you. Can you confirm to me your name and your date of birth?
My name is Sam, and my date of birth is 12/4/55.
And what's your last name?
Schultz.
Okay. And then, as I'm doing this all, I'm performing a 60-second assessment of my patient, just to make sure his breathing is okay. He doesn't appear to be in any respiratory distress. Also checking whatever equipment may be hooked up to him. If there's all of the equipment that needs to be there, suctioning canister, oxygen supply is ready for me to tap into should I require it. Also doing a safety evaluation, making sure there's no clutter in the walkways and any potential falling hazards. Then I'm going to check my patient's vital signs. So I do all of that. And then after that, I will ask my patient, so you came in today reporting that you had blood in your urine.
That's right.
Yes? What do you think led to this happening? What do you think?
Well, I had an operation just less than a week ago.
What sort of
An operation on my prostate.
You had a TURP?
I believe so. Yes.
Okay. Have you been feeling great urgency and frequency with your urination since then?
Yeah, I piss all the time.
You do. Is there any pain when you pee?
Yeah, it hurts a little bit.
What about the coloration of your urine? Have you noticed any cloudiness?
Well, it's a little bit differently cloudy. Yeah, it's not so clear as what it normally was.
Okay. And do you feel like you may be retaining urine? Do you feel like when you pee, not all of it is able to come out?
Yeah, it just kind of dribbles. You don't really know if the end of the sack is empty or not. You know what I mean?
Okay. All right. Let me just feel your bladder, and then I'll look at everything else that's going on in your body, and then when we're done with that, I'll get a bladder scanner and check how much urine you are retaining.
You need me to stand up or sit down?
No, you could sit down. Just remove your shirt so I can see your abdomen. And then also later on, if you are able to urinate, we probably will want to get a sample from you, just to test to see if there's any infection going on. Okay, it does feel a little hard, a little distended. All right, we'll come back to that in a moment. Where did my equipment go? So, let me just take a look at your head right now. Have you had any loss of sensation recently? Like you notice your hearing or your vision's gotten worse?
No, not particularly.
Okay, no loss of smell or anything like that?
No.
Have you felt any headaches?
Yeah, I have a few, one now and again.
And on a level of 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt, how would you classify these headaches?
1 or 2.
And what would you classify as a pain that would interfere with the quality of your life on a scale of 0 to 10?
Oh, I don't know, 5 or something.
A 5. Okay. Can you open your mouth for me, please? Okay. Let's look into your ears. Okay. Okay. So now I'm moving on to neurological assessment. I can see from my patient's level of consciousness that my patient is awake and alert. Now I'll proceed to evaluate my patient's level of awareness. Can you tell me your name again, sir?
My name is Sam Schultz.
Sam Schultz. And what is the month and year currently?
I believe it is January of 2025, but could be wrong.
And where are we?
We're in my house, sitting here, making a video.
Okay, and what are we doing right now? We're making a video.
We're making a video.
So my patient is awake and alert times 4. He's alert, yeah, he's oriented to time, place, situation, person. Then now I will be assessing perla in my patient. So do you mind taking your glasses off for a second? I'll be checking. So just look straight forward. Okay. Okay, now look at this light for me and follow it. Okay, and the pupil size is good. Can you smile for me, sir? Can you stick your tongue out? Frown. Raise your eyebrows. Okay. Now can you put both your arms out like this? Close your eyes. And just hold that until I tell you to stop. Okay, and then I do it for the full duration of time. Moving onwards, you can stop. Now I'm going to do a respiratory assessment. Can you open up your outer shirt? So, beginning at the second intercostal space, I'm going to listen on both sides, on the left and the right lung. Breathe in for me. Okay, moving on to the fourth intercostal space. Now moving down to the eighth rib on the maxillary line. Okay. Okay, now could you lean forward for me, sir, and then remove your shirt just so I can see your skin on your back and your arms as well.
There we go.
Okay. Now I'm listening on the 10th rib on the axillary line, and then also closer inwards on both sides, on the left and the right lung. Then moving upwards, I'll be on the bottom edge between the spine and the lower tip of the scapula on both sides. It's the fifth rib. Then I'll move to the top and do the top side, between the top side of the scapula and the spine on both sides. Okay, now I'm just going to take a listen to your heart. Have you felt anything, do you have any history of heart problems?
No.
Have you felt any palpitations recently? Any
No.
chest pain?
No.
No? Everything just feels normal to you?
Yeah.
First, I'll be listening at the second intercostal space on the patient's right side. Then I'll be moving on to the other side on the second side, on the left side. That's the pulmonic valve. Moving down to the second sorry, to the third, to Herb's Point. Then the tricuspid. Then finally the mitral. And I'll listen to my patient's apical pulse for 60 minutes. Let's just say I do it. Okay. Moving onwards, I'm going to be moving to my patient's GI system. So I'll begin by asking a series of questions. So what has been your bowel elimination pattern been like recently? Everything is normal?
Everything is normal.
And okay. And what about the characteristics of your stool?
They're generally fine.
They're generally fine. Okay. No, so no, nothing that worries you at all.
Nothing that I pay any attention to.
Okay. I'm just going to listen to your stomach. And I'm going to be on each quadrant for 15 seconds listening. If there's less than 5 sounds, that's too low. And if there's more than 7, that's too much. Within the 15 seconds. Let's just say I go for 15 seconds. Then once I'm done with that, I'm going to palpate my patient's abdomen. Okay, and I've already looked at my patient's GU system because that was the system that required my attention when my patient just came in. Now I'm going to be assessing my patient's extremities for the 7 Ps, which are pallor, polar, pain, peripheral pulse, paresthesia, paralysis, and puffiness. So I'm feeling my patient's, beginning with my patient's arms, I'm feeling the strength of my patient's arms, also feeling the temperature, the dryness, also observing the skin. So done all of that. I'm going to check my patient's pulses on both sides, radial pulse. And I'll do it for a minute. Yeah, just make sure they're equal. There's no discrepancy between the two. So they're good. I'll check for cap refill. Okay, cap refill is good. Ask my patient to squeeze my fingers at the same time. Squeeze those. And then also have my patient push on my arms. Push lower down there at the same time. Okay, and then now I'm going to do the same to you, and you resist. Okay, very good. So I've done the polar, I've done the pallor, peripheral pulse. I don't see any edema, there's no puffiness. That all seems to be good. Then I will do the same on the lower extremities of my patient. So feeling again, looking at the skin temperature, making sure that it's all strong. Okay, then, well, it's very inconvenient right now because my patient's wearing boots, but let's say I ask my patient to take off his boots. I would have him do dorsiflexion and plantar flexion, which is, pulling your feet upwards and downwards and just evaluating if they're equal strength. If my patient was laying down, I would have my patient lift one leg up in the air for a little while, hold it, and then do the same with the other one. And I've done the cap refill on my patient's feet. Checked out, there's no pressure ulcers on the back. Skin quality is good, skin temperature is good. And also check the pulse. I'm going to check my patient's pulse, the dorsalis pedis and the posterior tibialis, which is right here on both sides. Make sure that they're both equal. So that all appears to be good. I'm going to round it all off with get a little bit of sense of the social background of my patient, where my patient lives, perhaps my patient needs to walk up a flight of steps. Maybe my patient gets out of breath very quickly, all of those kind of things. So, where do you live? Do you live alone?
I live alone under a freeway on-ramp.
Oh, okay, all right. So I have a homeless patient, and then maybe connect my patient with a social worker later on. Well, I'm gonna get the bladder scanner, and we'll take a look at that, and then we'll take a look at how much urine you're holding up. Then I'll perform hand hygiene, and exit the room. You can stop it.